So my name's Adrian Richards. I'm a plastic surgeon, and today I'm going to be talking about Botox treatment for the upper face. So by the upper face I mean from the eyes and above, the lower face I mean eyes and down. Okay, so the classic three areas that Botox is most successful for are the glabella between the eyebrows, the lines across here, and the crow's feet area. And these are the traditional three areas that we've been using Botox on very successfully. So what actually happens in treatment? Well, we assess you because some people are frowners, some people are predominant smilers, some people raise your eyebrows more. So everyone uses their forehead, everyone frowns in a different way, everyone smiles in a different way. So actually, while we're talking to you in the initial consultation, we'll be looking very carefully at your face and working out what pattern of activity you're using. So we're not aiming to completely devoid you of any activity. What we're aiming to do is bring you into harmony to reduce the excessive activity, to make everything look balanced and nice, without the sort of over muscle activity. Okay. The other important thing to notice, if lines are deeply inset, they won't be fully cured by Botox, because it's a bit like folding a piece of paper again and again and again. So children frown, but because their skin is sort of malleable and plastic, when they're relaxed there's no line left. Okay? But generally as we get older, through sort of late 20s, 30s, we begin to have residual lines at rest. Okay? Particularly in the glabella area. So when you relax, the line will still be there. So Botox only works by relaxing the muscles. So if it's a very deep line, it won't get rid of the muscle completely, the line completely. So what we need to do is a test for this. If you just put your skin slightly on stretch, okay, if the line goes when you do the skin on stretch test, Botox will remove the line. If the line still remains, it won't go with one treatment of Botox. Okay, because although the muscle isn't working, the line is still indented. If you really wanted the line gone, we could do the Botox and then 2 weeks later use a dermal filler just to soften those lines for you. But most people are quite happy with the reduction in the line from the Botox, and then it's important that if you can have Botox 3 times in the first year, if we can keep that muscle down for the first year, the skin will recover, rejuvenate from the bottom, and the line will go. But it won't just go with one treatment, and if you just have the treatment and the muscle activity comes back after 3 to 4 months and you start folding again, you'll be back to stage 1. So we really need to keep the activity down for a year. So what we would expect is a softening in this area. You will still probably be able to frown. We don't want you completely frozen. There will be some activity, but you won't be able to sort of scowl and use that really, the big scowl that you had. If you are a mum, you need to be careful, because I've had mums saying that their children are a little bit confused afterwards because mum sounds angry but she doesn't look angry, and that does cause some confusion sometimes. So basically, it will soften the area, and you won't be able to look quite fierce and as troubled, even if you are. And the other area we treated the forehead lines, and some people have very deep lines across here. If you have deep lines, we need to treat them appropriately. Some people don't have deep lines there, so we perhaps don't need to treat that area, or don't need to treat it so much. The other main areas we treat are the crow's feet areas, which are these sort of lines radiating like a fan from the corner of the eyes. Some people like these lines. They are associated with smiling and happiness, and we can just soften them. We discuss with you. Some people would rather they were really quite reduced, other people elect to keep them, so it's really a personal decision. But importantly, if we can weaken these muscles slightly, these are the muscles which tend to pull down the corner of the eyebrow, so if we can weaken them slightly, the eyebrow will go up slightly, and this is what's known as a chemical brow lift. So with some people, we can get the eyebrows just to go up slightly, which produces a slightly more awake and healthy appearance. So in summary, upper face Botox is very successful. It's got a proven track record with time, very low problems associated with it, unlike lower face Botox, which I'm going to talk about in the next video. safe, predictable, good results, low complication rate, and as I mentioned before, our aim is really to sort of create harmony in your face rather than create a frozen, unnatural look. So thank you very much for listening and watching the video. If you have any questions about this or any other topics, please don't hesitate to contact us either via the website or via phoning us on 01844 214 362. Thank you very much.